As we work through these structures, you'll notice that we are not addressing a majority of the muscles we covered in the lecture. In reality, we are. Through both the stretching and the reciprocal inhibition, we will have worked every one of the really hard to reach muscles to varying degrees as well. So we'll start with the client supine and have them move themselves towards the end of the table so that their head is resting comfortably in our hands and not on the table. We're going to rotate the head and place broad finger contact just above the clavicle. We're going to slowly lower the client's head down. And we're going to do several passes working superiorly towards the mandible. And of course, when we're done with one side, we'll then do the other. Broad finger contact. It's not a deep contact. Think of it as just really pulling the skin as we move. We'll have the client push their head into our hands as we go through this. Good. And the other side. Start here. Push your head into my lower hand. Good. And again. Good. And again. Good. Back to neutral. Then I'll have you scoot on back down. So we'll start with the sternocleidomastoid mastoid. Well, first, we'll begin with the client lying supine or face up, and then we'll have the client scoot down towards us so that her head is come off of the table. With the client supine, head off the end of the table and in the therapist's hands, we will place our contact at the medial clavicle, right about here. Rotate that head contralaterally, bringing the head up slightly, and then we will have the client extend her head off of the table into our hands. With each pass, we're going to move superiorly from the origin to the insertion. We can work both the clavicular head and the sternal head. And of course, we'll work both sides. Starting with the clavicular head. Now, can we do this bilaterally? Yes. It works for working the sternal head more than the clavicular head. And it can be a little uncomfortable for the client. And if your hands aren't big enough, you're not going to be able to give the head enough support. But in certain cases, it can be useful. The scalenes can be worked as a group with simply a change of placement of the contact at the origins. The muscles can be worked individually if needed, and instructions for refining this work to isolate the individual scalenes is found in our handout. We'll start with the client supine. The therapist will lift the head, placing a hand underneath it for support. The other hand will find the origins of scalenes down at either the first rib or the second rib. Place firm pressure, and then have the client flex her head laterally so that the opposite ear goes to the opposite shoulder. We will work up the line of the scalenes all the way to their attachments. And we'll be doing this work for each scalene, anterior, middle, and posterior. And of course, we'll work the other side. We'll now focus on the upper fibers of the trapezius. Again, with the client supine, we'll raise the client's head, cradling it in our hands, and with the opposite hand, bring our fingers up underneath the shoulder blade and find lateral attachment of the upper fibers of the trapezius down here in the shoulder. And it's the same action by contralaterally putting the ear to the opposite shoulder, like so. And we will follow the fibers of the upper trapezius all the way to the origins, neck. You can also take a broader contact if you wish with this, using a flat of the fist, using the palm, fingers, whatever is comfortable. Good. Client will begin supine and we'll be standing or sitting, depending on the height of the table, behind them with our fingers within the lamina groove bilaterally. We'll have the client rotate to the opposite side. Say if we're working the right side, we want her to rotate to the left. And we'll work our way up from that point, from C7 all the way to the base of the skull, and working both sides. Bring the client's head up, place the contact within the lamina groove. We'll start with the client's head rotated to ipsilaterally. And then from here, we'll have the client rotate contralaterally to the opposite side. Boom. And again. Boom. And again. Boom. Good. And then we'll work the opposite side. So we'll start with the client rotated to the same side, and then we'll have her rotate actively to the opposite side, helping her out oh so gently at the end. Good. And back to neutral. Fluff, 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 fluff. For the multifidi, we'll begin with, again, the client supine, and we can either be standing or sitting behind them, depending on the height of the table, with our fingers, once again, in the lamina groove bilaterally on both sides. We'll have the client moderately flex to the opposite side. That is to say, if we're working on the right side, we want them to laterally flex to the left. For the camera purposes, we're going in the opposite direction. And we want them to rotate to the same side. So what you're seeing here is a lateral flexion to the right, but a rotation to the left, just like that. To begin, we'll start with the client in the exact opposite position because this shortens the muscles. So they will be laterally flexed to the, in this case, the left side or the same side and rotated away. Then she will laterally flex to the opposite side and rotate to the same side, like so. And we will move our way up. Just like so. The nice thing is, when we're at the end of one side, we can begin the other using the same motion. Good. And down. Fluff, 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 fluff. This is a rather complex way of moving, something that does not come instinctually to the client. So I always will take the client through a couple of iterations passively first before I have the client work that motion actively. The actions of the suboccipital group are so similar, in fact, that we can use a single broad contact using the entirety of our fingertips across the base of the skull to affect all four of these muscles. Again, with the client supine, we'll raise the head, cradle it with one hand, rotate it oh so slightly. Find ourselves just behind the mastoid process on both sides. From here, we will gently flex the head, focusing on flexion at C1, then rotate. Do several iterations of rotation. From here, we can also do slightly more. Moving on to the splenius capitis. The client face up, we will cradle the head in one hand, lifting up and finding our point of contact just lateral to C7. Then we will have the client rotate her head contralaterally and flex. And we will move our point of contact all the way up to the base of the skull. On the other side. This muscle can also be worked bilaterally, but I have found it is more effective to isolate it to a single side, working both muscles individually. To work the levator scapula, we're going to start the client supine, head elevated slightly and slightly extended. We'll find our point of contact at the medial angle of the scapula, and we will have the client contralaterally rotate and flex her neck so that she is looking down at her own knee. sides.